Today, we're going to be talking about pain in the front of the shoulder that just doesn't seem to want to go away. We'll go through, is it serious, when you should be concerned, why it's not going away, and what's causing it to begin with. What's up, guys? Ben here with Evo Performance Therapy, and today we're talking about pain in the front of the shoulder that just doesn't seem to want to go away. This is a super common issue that we see in the clinic. We treat it multiple times a day, several times a week. So if you are into CrossFit or lifting weights, you put things over your head, you're active, you likely have experienced this at some point. If you haven't yet, it will probably come up at some point. So the reason for this is we see pain in this region of the front of the shoulder. It's super common because so many things attach there. So the attachment site for a bunch of muscles, it's right here in the front of the shoulder. It can kind of radiate. It can be sharp. It can be achy. It can be both. But if we look at a list of muscles that attach to this area, it's pretty long. Pretty much anything we do with our upper body is going to be implicated. It's going to be involved right around through here. Your rotator cuff, your pecs, front of the deltoids, long head of the biceps. The list goes on and on. So why is that pain happening to begin with? So if we break it down, kind of the basic anatomical structure, we have tendons. So these tendons attach muscle to bone, right? So the muscle comes down, condenses into a tendon, and that attaches to the bone. So when the muscle contracts, pulls on the tendon and the bone, and that's how we move. So the way things typically work when we are exercising, when we're active and our muscles are contracting, when we're lifting weights, the muscles contract and we're lifting against resistance, so it breaks down the muscle. So it causes these micro tears, these little mini tears to our muscles, which is basically like a mini injury. So you're not really injured, but you basically are causing some micro tears to the muscle when we're lifting weights, when we're training. And so what that does is it signals our body to heal the area. So this is why we get sore, where we go and train, we stress the muscle and the tendon, and it signals our body to start that repair process. So the first stage of that process is the inflammatory process. So we go and we train, break down the muscle, and our body is signaled to say, hey, we need to start this healing process. Let's send some inflammatory molecules to this area. So typically we're just sore for a couple days, usually 24 to 72 hours. Our body heals it up, and we come out stronger than before because we've built everything back up. What'll happen though, if we are not overtraining isn't a great word for it, but if we are pushing beyond our recovery ability, so that could be maybe we're not recovering enough. So if we're not sleeping enough, we're not eating enough, we're dehydrated, we're overstressed, or if we are training more than usual, if we've added new amounts of training, if we're deep in a training cycle, if we're peaking for a competition, or some combination of those two things, we might not be able to recover between training sessions. And so that inflammatory process never really runs its course, and the tendon just stays inflamed. It never moves to the next stage of healing and never kind of wraps that up. And so that's when we call like tendonitis, or more recently we call it like a reactive phase tendinopathy. So we have this inflamed tendon and it just hurts. So initially, it's not a huge deal. That is going to happen maybe after a week or so. You notice that you're a little more achy. It feels like it's in the joint. You may feel that kind of achiness, maybe even a little bit sharp pain when you're training. The fix for that is typically to back things down a bit. We can decrease our training volume, maybe take an extra rest day, and really make sure we're sleeping enough and recovering. It's a pretty quick fix. You can mask it with anti-inflammatories, but it's not truly fixing the problem. So short term, we just kind of want to rest it, not super serious. However, if this continues for a long period of time, that tendon stays inflamed, we're not able to recover, that inflammatory process can't run its course and kind of close that loop. Now we get more of this chronic tendinopathy, or what we call like a tendinosis, and that's where the actual collagen fibers start to break down at the tendon. We can see if this happens chronically, we get kind of a degenerated tendon, and those can eventually lead to tears and larger injuries. They also can just hurt for longer periods of time. So if you've heard of someone that's maybe had like tennis elbow for years, or they've had tendonitis in their knee for years, that's usually more of this tendinosis, or this chronic degenerative phase tendinopathy. And the treatment for this is actually quite different. This is really important to get diagnosed because rest no longer really helps it. The pattern that we see with it is that it kind of hurts, maybe it hurts at night, first thing in the morning, it's pretty achy when you're warming up. but you get warmed up and you actually feel better with movement. So you warm up and you work out, you're feeling really good, but then you cool down later in the day, it starts to ache again. And people live in this cycle for years at a time until they finally can't take it anymore or they sustain a larger injury. So the treatment for this actually is we need to restore the load tolerance and actually rebuild those collagen fibers, rebuild that tendon. And that takes a couple different things. You want to get it assessed to get a really good plan put together, but typically it involves some amount of isometrics, some tempo work, some kind of slow tempo, full range of motion work that has progressed based on how much range of motion you're using. So you stay in kind of a comfortable range of motion, keeping your pain levels manageable. And you progressively overload the tendons. And those programs can run anywhere from 6 to 12 weeks. So we'll run these for patients for like if we have like a chronic tendonitis, chronic tendinopathy for a knee, we can run this 12-week squat program that tends to knock it out. But it's specific to the patient, and there's a certain progression that we have to undergo that is specific to the patient. So that's where you really want to get it assessed. So when we have pain in front of the shoulder, if it's been going on and it kind of follows that pattern of what hurts, but then I work out and it feels better, but then it hurts again. If that's the case, if you have that, you definitely want to get that checked out and get that treated and intervene so that one, it doesn't stick around forever, and two, you're not actually continuing to break down that tendon and put yourself at risk for a larger injury. Now, the really serious things we worry about with kind of this pain, there's really sharp pain if you say maybe you're bench pressing and maybe you feel a pop and all of a sudden there's over a couple hours or days there's a ton of bruising, you see maybe a deformity in the area and you have this front of the shoulder pain, that's more indicative of kind of an acute tear, which is definitely something more severe. That's definitely where you're going to want to reach out and get that imaged, maybe go to the orthopedist and see what's going on. If we do get a full tear or tearing the tendon off the bone, like an avulsion, or if we're just tearing the muscle belly, tearing where that tendon is, whether it's partial or full, that's something that can require surgery or requires a bit more of an aggressive rehab program. So typically with that, there's a definite mechanism. You're going to feel a pop, you're going to feel it pull. It's pretty acute. It's not a gradual onset. And you'll typically see some bruising with that. So, muscle strain, muscle tear, it's all kind of the same thing. A tear is just a really bad strain, and a strain is just a really light tear. But when you see a lot of bruising through there, that's usually a sign that the tear is a bit more severe, and we do want to get that checked out. A lot of times this pain in the shoulder will get misdiagnosed as just biceps tendonitis. That can be the case, but oftentimes we have some other things involved as well, whether it's pecs or rotator cuff. So, if you just kind of Google it on the internet, you might just find, front of the shoulder, it's just bicep, no big deal, I'll do some bicep curls. It's a little more nuanced than that. We want to make sure we're hitting the right head of the biceps. Are we addressing all factors that can be contributing to it? There's a lot of things that go into it. So that's it. That's kind of my spiel on pain in the front of the shoulder. If it's not going away, that kind of gives you an explanation as to maybe why. Maybe it's more of that kind of tendinosis that you're dealing with. So if you want to learn more, you can check us out at www.evoperformancetherapy.com. We're a team of doctors of physical therapy that work with active people. We treat these issues all the time. So check the link in the description and you can give us a call, check out our blog, or give us a follow on social media.